Welcome, everyone. Thank you for joining us. I think we'll go ahead and get started. This is our weekly update for the week of September 29th. And I'll send out notes after this call. I'm just going to walk everyone through several different updates online, and then we'll have lots of time for questions and answers today. And then I'll send out notes after this call. So if you'll allow me to share my screen, I'm just going to share my interweb and go from there. So we'll talk about COVID and then monkeypox, and then a couple of other announcements from the CDC, and then end with a reminder about fentanyl and opioid use disorder. When it comes to COVID, here's our hospitalizations. Hopefully you can see that. I can make it a little bit bigger. We currently have 93, so it's less than the peak of 241 that we did have in late July. However, it's still, it is what it is, 93 patients and falling. Our trends indicate that we're in for a few weeks at least of good times in terms of COVID numbers. However, we do know that as the weather gets colder, the flu season and the winter respiratory virus season may bring additional surges of patients. Right now is the time to get everyone boosted and vaccinated. Really, your healthcare staff, all of your vulnerable patients, all of your friends and families, and your favorite children, go ahead and get them vaccinated. Protect everyone, make sure that you get the word out. These boosters, the bivalent boosters are really the way to go if you qualify for them, which is really everyone above age 12, and the flu shot for everyone over age 6 months. You really want to make sure that you're getting the word out about how important vaccinations are. Even though the numbers are going down, we know that it's just, anyone's guess when the numbers will start ticking back up again. And the best way to avoid a surge is to get those vaccines into people. Around the world, people are describing a pretty busy flu season, especially in the southern climes where the flu season arrives earlier than it does here in the northern hemisphere. People are describing a pretty busy flu season. So we're not yet done with these respiratory viruses, even though, quote unquote, as has been widely publicized, the pandemic is over. We're still dealing with the endemic phase of COVID and the seasonal phases of flu. So just keep that in mind. I feel like I'm preaching to the choir. You all know this, but it is important for all of us to be united in this. When it comes to getting people over age 50, the CDPH is really trying to get more and more messaging out to let people know about the boosters and also about Paxlovid and other treatments. They're really finding in some of their research that people are unaware that you can get either one of those, and that you should get those if you are in the elderly population. And so that's why I just put this in there, that you're going to see more messaging about targeting those groups whenever it comes to getting them protected. And sorry, I'll have to switch back and then share my screen a different way. All right, one thing that did come up as a source of confusion is the whole masking in healthcare. So you might have heard that the CDC made some updates last week about softening the requirement for masking in healthcare. To tell you the truth, I didn't even pay attention, and it doesn't really even matter because the CDC makes recommendations and the CDPH makes the law. And so just to let you know, CDPH has not changed a single thing about their masking in healthcare policy. So all the things that we are already doing about masking in healthcare are still exactly the same. And the CDPH has come out and said that in not so many words. So that's why you haven't heard anything at the state level, even though the CDC made a rather controversial and bold statement that we could soften masking requirements in healthcare. CDPH is really just choosing to ignore that. And I think that that's wise, because I think that with the flu numbers going back up, whenever that happens, the CDC is going to have to reverse course and then make people mask up in healthcare settings again. That's really my instinct that that's what's going to go on. So that's kind of why there is a little bit of confusion about the masking in healthcare. Just to share with you what this guidance looks like. This is basically CDPH guidance from September 20th, where they really clarify what should happen with face masks. The only thing that's changed is that the CDPH has chosen to shift from a strong recommendation for everyone to a strong recommendation only for medium to high risk of transmission counties. And we're now a low risk of transmission county. So we do have a little bit of softening, but that's outside of healthcare. Remember, that's in things like correctional facilities, homeless shelters, emergency shelters, cooling centers. We can now align with the CDC guidance on that. But whenever it comes to within our hospitals, our clinics, our dental offices, all of our other counseling and other work that we do for our patients, still going to have universal masking. Okay. So I will share a link to this very important document because I'm sure you're fielding questions about this. We're still trying to wrap our heads around the implications of it, but for now, we've very pointedly asked the state, and the state has said that we're not really going to change much and to just stick to the usual masking and healthcare guidance. Sorry, I keep having to switch on and off with this. All right, let me go to the chat and see if I see a few questions popping up or a few comments popping up. And Sim is sharing this in real time, so you can sort of follow along there if you need those links. And like I said, we'll bundle all these up and send them out after the session. All right, let's keep moving. We're going to talk about monkeypox or Mpox as it's now called. There's a huge amount of information coming out that we're really looking at the sexually transmitted route as the major route of Mpox transmission. And HIV patients, immunocompromised patients are really high risk. So MMWR actually came out with a couple of different studies that got at this. This one is from last week's MMWR. This is about HIV and STDs in patients with monkeypox. And they were able to show that like 40% of patients with Mpox diagnosis had a concurrent HIV or STD diagnosed in the last 12 months. So that was a very important reminder that all of these sexually transmitted infections are traveling together, and now Mpox is along for the ride as well. Please, please keep that in mind whenever you see patients that you're ruling out for Mpox. Also go ahead and rule out other STDs that cause skin changes, such as syphilis, herpes, and others. If you have HIV patients, make absolutely sure that they're getting their vaccines. Make sure they know how to get the Mpox diagnosis by either directing them or testing them yourself. And then make sure that they know about the antiviral program that's very graciously offered by UCSF Fresno's infectious disease team. The antiviral, as you'll remember, is called TPOXX, and the UCSF team is ready to help treat your patients. You just need to contact them with a quick phone call and they'll arrange appointments. They may need to meet them. They may need to meet the patients at your clinic if there's not a better place to put them and see them. However, they do want this antiviral to go to patients that need it. And so we're so glad that they're able to lead the way for our county in offering this program. Okay, so that's Mpox. One thing that did change, and I don't even have this in writing yet, but it's something that they talked about at considerable length on yesterday's phone call with all of the health officers in the state, is what's known as the aerosolizable disease something criteria. It's called the ADT, sorry, I think transmission. Yeah, aerosolized disease transmission criteria. And that is something that's actually set up by Cal OSHA. And Cal OSHA says, if you have an aerosolizable disease, here's how you're going to protect your employees. And obviously in healthcare with aerosolizable diseases, this is what sets up all of the rules whenever it comes to how we manage in healthcare. They've actually added language about Mpox in that ADT standard. And the language about Mpox, and again, I don't have this on paper yet, but as soon as I get it, I will share it with you. Will say the following: if you are seeing a patient with Mpox and dispositioning them within 5 hours, then you can basically treat them as if they have MRSA, for lack of a better parallel. Okay, you don't need to put them in a negative pressure room. You don't necessarily need to do anything differently than what you're already doing, which is universal masking in healthcare and PPE contact precautions, et cetera, the way that you would with MRSA. If they're going to spend more than 5 hours in your operation, whether that's the emergency department, your outpatient clinic, your hospital, if they're going to spend more than 5 hours with you, then you've got to put them in a negative pressure room, because that's basically going to convert them into the ADT standard, and you've got to put them in negative pressure room. Okay, so that's my takeaway from this very verbal back and forth that happened between Cal OSHA, CDPH, and all of the health officers. But basically, you're going to have a 5-hour time clock to see, treat, and disposition those patients. If for whatever reason you decide to admit them, or if it takes longer than 5 hours to kind of get all of that stuff done, then you're going to need to either, well, it's almost unthinkable, keep that patient outdoors to protect everyone involved, or put them in a negative pressure room, which is the preferable environment, in order to protect the rest of your staff and patients. So I know that that's going to present some challenges, but hopefully also give you an opportunity to make your protocols align with that. And whenever you get a chance to review it on paper, I'm sure there will be better information than what I'm providing right now. But that's basically, just remember the 5-hour rule whenever it comes to treatment of Mpox. And Anna is adding something to the chat. Although I'm not sure, are you talking about Mpox or COVID for testing? You can feel free to unmute if you're at a place where you can unmute, Anna. Oh, got you, for COVID. All right. Great. Let me know if anyone has any questions about that or needs more context. All right. Let me go back to my little agenda reminder. That's really all of the comments I have about Mpox. Just remember, we continue to see cases. It is slowing down statewide, although we continue to make new diagnoses. We've had a few that are close household contacts, not sexual contacts, although the vast majority of them are sexual or intimate contact. And just like national averages, about 40% of our patients are HIV positive. So we're very worried about our HIV population here in Fresno County. We want them protected. We're trying to get them vaccinated. If you're treating those patients, please make sure you do what you're doing to get them vaccinated, because it's going to be really important to protect that patient population, given the fact that so much evidence is now pointing to the close relationship between HIV or STD diagnosis and the monkeypox epidemic. All right, there's a couple of upcoming COCA calls and learning opportunities. Oh, one more thing about Mpox. This is actually a piece of good news, which is that even though all the stuff that I just said still applies about negative pressure rooms and the 5-hour rule, et cetera, one piece of good news from the national literature is this MMWR that also came out last week. And this basically shows that the risk of healthcare personnel catching monkeypox is super duper low as long as the PPE is being worn. And so this is just, for those of you that are fielding questions from your staff about how well are you protecting us with monkeypox, et cetera, well, you can tell them, you know what, you can go ahead and get vaccinated. There's a lot of vaccines in the county now, and we want all healthcare personnel who want the vaccine to be able to get it. And so we basically added that to our eligibility criteria. And this MMWR, which came out last week, shows that the transmission is almost none whenever people wear their PPE. And even when they don't wear their PPE, it's still pretty low. So again, there's a great line in here where it says 28% of HCPs were considered to have high or intermediate risk exposures, and only like 23% wore all recommended PPE. So it's I cringed when I looked at that, because it's just like, yeah, even though you have lots of flyers and training and stuff, only about a quarter of them actually wore all of the recommended PPE. And so it just goes to show you that you have to constantly remind your folks to use the right protective gear. And that means eyes, gowns, gloves, obviously, and the face masks. But nonetheless, even with that low adherence of PPE, the way that it's recommended, the risk of transmission in healthcare settings is super duper low. And again, it aligns with the contours of the other findings, which show that this seems to be a disease of intimate, if not sexual contact for the most part. And Tim just dropped that in the chat too. Thanks, Tim. All right, a couple of more calls that the CDC is putting on that I think are worth your time. So one of them is the series, the COCA series of calls, which we've talked about before, and they actually have COCA calls now. They're getting really fancy now because they basically have now gone to COCA calls on. Let me see if I can find it here. On dengue fever. So what clinicians need to know about dengue actually going on, it just happens, but they always record these. So you can actually find this one archived and recorded. And then upcoming COCA calls or recent COCA calls are all listed here as well. And these are, having to do with COVID, complications of COVID, influenza in children and how to protect children, the bivalent boosters, a lot of polio in New York and everything you need to know about polio. These are really highly recommended. The CDC always kind of hits a home run whenever they get these nationally renowned and internationally renowned speakers to talk about these topics. And as you can see, there's a lot of free continuing education that's available on these COCA calls. One more, speaking of respiratory illnesses in kids that are not COVID, there's actually a whole series of different rhinoviruses and enteroviruses. There's one that's a little bit scarier named D68 or EV-D68, and it can actually cause a polio-like illness called acute flaccid myelitis. And it seems to occur every 2 years, which is really interesting. But we're due to have a little uptick in acute flaccid myelitis because it happens on even years. And so the CDC is putting out MMWRs that sort of describe transmission and just getting people to be more aware of this is to say, if you have kids that are, certainly try to protect them as much as possible. But even if they do end up getting these cough and cold type of viruses, the real complication is flaccid myelitis, where they just have weakness. It looks like polio. It can look like botulism, et cetera. And they would need to have special labs done to try to rule out this disease entity. And so this is a MMWR that talks about the D68 syndrome. We haven't had any cases that I know of in this county, but thankfully, it's like the one virus that we're not dealing with. But we have had a couple of close calls where it was actually investigated and ruled out. So please work with us, contact our communicable disease team. If you do happen to have cases of kids that come in with what looks like acute flaccid myelitis, the differential is pretty long. It could include a lot of other things, including polio, but we're happy to help you work through that differential and help really get the specialized testing that needs to be done with this complication. And you can read more about it in this recent MMWR. Then the last thing that I just wanted to remind everyone of is that we have set up, actually the county set this up and I don't even know when, but this is something that has been shared across the state. And this is basically the Fresno County Dangers of Fentanyl website. And this actually goes through and gives you some really scary information. First, there's a lot of ways that young people are actually able to access these street drugs. And they actually use like emoji codes, which I don't know if we've ever shared this before, but if they're looking to purchase or sell these street drugs, they're not actually going to spell out Xanax or Percocet. They're going to be using these crazy symbols on the emoji pad. So that just goes to show you the era that we now live in, where emojis are being used to sell drugs. And this is something that the DEA really keeps track of, and they're able to share what these signals look like just for your own information. Obviously, if you see this on your kid's phone, be very worried. And I'm not trying to be frivolous or flippant about that. I really am worried about all the young people in our county. But beyond that, just, you know, educate your patients who happen to be parents, your patients who happen to be adolescents and youth, that these are out there. Law enforcement also shares great flyers, such as about fentanyl, which are more like public service announcements, but can also teach you a lot about what fentanyl looks like. It's basically found in everything. You've heard me say this before. It's being found in methamphetamines. It's being found in what's called street Xanax. It's definitely found in prescription opioids that are being sold out on the streets. Now they've come up with something called rainbow fentanyl, which is truly evil. And rainbow fentanyl is exactly that. It has many different colors, and it looks like candy, and it may actually attract even younger kids just because it looks so attractive, that it's very scary, but it's out there. Today, the MMWR put out an article about something called parafentanyl or parafluorofentanyl. So it's not just fentanyl as one compound. It's literally dozens, if not hundreds of compounds that act on the opioid receptor. There's another class of compounds called the nitazines, and the nitazines are not going to show up on your urine drug screen. They're not even going to show up on the urine fentanyl screen, but they are opioids and they will cause the same sort of syndrome. So all of that really, all of that is really a good reminder that, you know, this is a pretty complex topic. The best thing that we can do is educate parents, young people, get people into recovery who need to not be on street drugs, and really get them help by getting them started on what's known as medication-assisted treatment, and also get Narcan out there. So your clinic can apply for Narcan. We can actually share some of our Narcan if you need it. Our hospitals, CRMC, Clovis Community, many of the hospitals around town are now handing out Narcan to patients and their families. That's an important first step, but really it's the whole package. It's the education, the Narcan, and the access to recovery. All of that has to be in place, or else we're going to lose people, unfortunately. So it's a big lift, and we've all got to do it together. But thankfully, we know a lot about how to do it efficiently, so that it doesn't take up your whole day or your whole time. And we can actually help you and provide technical assistance so that you know what the shortcuts are to get all of this stuff up and going to help your patients. So please reach out to us. You know, we can do it over Zoom. We can get your doctor's X waivered over Zoom. We can get you to apply for Narcan and really walk you through that very short application. And we can get you tons of resources. Start here at this webpage, but then there's a lot of resources. I actually went to a toxicology conference last week, and the DEA was there. And the DEA, I know, the DEA showed up to a toxicology conference. They actually were handing out USB flash drives with like a ton of information. And so I actually have, I have it right here. I know. It's basically, it says DEA on it, which is so cool. You wonder if this is like a tracking device, but nonetheless, it basically has just a ton of files from the DEA who are doing some really amazing stuff. You know, they take a lot of lumps for the drug war and the war on drugs, but they're actually trying to be as responsive as they need to be in addressing the opioid epidemic. They're working with non-English speaking communities. They're working with Native American communities. They're working with young people. They're really getting on social media. They're the ones that came up with this emoji graphic. So they're doing what they can to try to address the era that we're now living in. But you know, like I said, it's a team effort. Everyone has to be aware of this, and everyone has to kind of do what we can to pitch in and help with this, or else we're never gonna be through with the crisis that opioids represent. Anyway, if you have any questions, let me know. But please start here, at least know about it, and at least take the time to have this somewhat awkward conversation with your loved ones and with your patients, and really just ask, you know, what can I do to help? How are you coping with all of your stress? And if they're saying that they're using drugs to cope with stress, that's a huge red flag, or even alcohol for that matter. And really just guide them into the recovery resources that are out there. Behavioral health has a lot of recovery resources. There's a lot of private companies, et cetera, depending on what the person's coverage and insurance status is. There's a lot of help that's available. It's just a matter of identifying who's at risk and really getting them plugged into recovery resources. And it's up to all of us to help do that. And Sim is sharing all of these links as I talk about them. So in real time, he has no preparation. So he's like, amazing. Thanks, Sim. I think that's really all I have to share in terms of websites and web links, et cetera. But I'm happy to talk about anything or field questions if people have them. So I'll just open it up to the floor and see if anybody wants to unmute and ask questions. Thank you. All right. Everyone's just looking forward to Friday, enjoying this beautiful weather. We just did a press conference at the big Fresno Fairgrounds this morning, so that's something you can look forward to next week. Is you know, a bigger and better Fresno Fair this year, and lots of other celebrations going on. I know Clovis Fest was a big success, so I'm glad all that stuff is coming back. I think you know, it's about time, and I think it's going to really help with people's mental health and wellness as well. So hopefully you can take time out to do some R&R with your loved ones. I'm just checking the chat here. Oh, is Fresno going to go with not testing the unvaccinated healthcare providers? Yeah, that's a good question. We were told that that is going to be a new policy at the state level, is that they are going to allow not having to test unvaccinated folks every week. And so that's something that you can look forward to. We'll try to track down the guidance on that and go from there. We're not going to be more strict than the state. So whenever the state is ready to pull that trigger, then we'll go ahead and adopt that same policy that the state recommends. So I think they are going to move to, especially in communities that have lower risk of transmission like we do now, not having to do weekly testing of the unvaccinated. And when we say unvaccinated, we mean for COVID. Remember, with the flu, there's still a healthcare mandate in place for that. And hopefully your folks will get their flu shots. They can opt out if they have a strong religious preference not to. However, that's something that you'll need to work out and document. And they'll need to wear their masks. But you know, with universal healthcare masking, that kind of goes without saying that they'll be required to wear masks. Will they need an exemption from the booster? No, they won't. So the booster is quote unquote optional. It's not a mandate. And so if they choose not to get the booster, which I don't recommend, I do recommend getting them the booster. But if they choose not to get the booster, then there's really nothing you need to do or document. It's totally optional. Is the health department doing flu clinics this year? Yes, we are. And we can actually share out our flyer that has all of the flu clinics. When you say travel flu clinics, I imagine you mean like mobile clinics. So there are different clinics around town that will offer flu shots. They're mass vaccination clinics. And we're actually trying to make them like bundled so that you can get flu and COVID booster at the same time. And so most of the clinics are actually going to offer both at the same time. And there's a whole flyer that we've made that shows where all those clinics are happening. And there it is. So if you look on the chat, you'll be able to see it. And I can just share that. I'll just share the screen so everybody can see it. These are all of our flu clinics around town. We actually had our very first one. Well, we're planning it today at 5 in Dunlap, California. And the rest of them are through the month of October going into November. So hopefully you can post these all over your clinic and have handouts for your patients to walk away with, or send them if your patients are able to receive emails, just scan them and send them to their emails so that they have this in their hands, and then they can basically find these mass vaccination clinics. and they can register for all of these at my turn. And if they don't want to register, then walk-ins are also welcome. So these are all of the flu/COVID clinics. They're really designed to be flu mass vaccination clinics, but like I said, our immunization team is able to work in COVID for the vast majority of these. So that's really good news too. All right, any other questions? These are great questions. Thank you all. Feel free to unmute if you want to speak up. All right, well, if there's no other questions or comments, I think we'll go ahead and adjourn. And we will send out the notes from today's call and look forward to any other questions or suggestions that you have. Please reach out to us over email until next time. And maybe we'll see some of you at the fair.
Thank you, Dr. Vohra.
Thank you all. Take care.